Welcome. I'm David Knowlton, Chairman of the HealthWell Foundation. For 20 years, HealthWell has worked to reduce financial barriers for underinsured people with serious life-altering disease. Today, we're the 23rd largest charity in the nation. In 2023, we awarded more than $1 billion in co-payment and insurance premium assistance to more than 200,000 underinsured patients. To tell me more about HealthWell, I'm here today with Stephen Weiner, former board chair and currently HealthWell's chief compliance officer. Steve, you were a founder of HealthWell 20 years ago. What need did you see then?
Thanks, Dave. We were looking at a major gap in the healthcare system in the country, which had to do with people who had insurance but were unable to afford their high-cost medical treatments because of the high level of out-of-pocket expenses being imposed on them. So there was research being done about what has now become called financial toxicity, where people are being forced to make choices between taking their medications or paying their rent, literally, or buying food, where often they would, in fact, stop taking their medication because they couldn't afford the out-of-pocket expense, or cut the medication in half and therefore make it more ineffective. There were really moral dilemmas of a major proportion. And we're talking about people with life-threatening diseases who were just facing impossible consequences because of the expense. So we looked at a way of how to provide support for them. The challenge for us is that we were dealing with a population that has insurance, whether it was private insurance or, for example, Medicare, public insurance programs. If people are uninsured, pharma could actually provide free or low cost products, but they can't do that with people who have insurance because of a variety of federal and state laws that we don't need to get into unless you really want to, but they're quite complex. As a result, while we expected that pharma would be a major source of funding for us to be able to pursue this mission, we needed to comply with some very complicated regulatory structures, guidelines, to make sure that, in fact, we could accept those without adverse consequences. So for us, compliance really became a key part of our mission from the very beginning.
Well, that certainly sounds like a worthy mission, but it sounds very complicated, especially in the context of federal laws. Can you say more about that, how you work your way around that?
How we worked with it, you mean? Indeed. Yes, it is complicated. The rules associated with how we could do it are very complex and very prescriptive. The process was the following in the simplest terms. One, we created a charitable organization so that we could take donations from pharma, but also from other people as well. In fact, at this point, we have about 80,000 individual donors in addition to pharma. But the bulk of the money is clearly coming from pharma. And so, along with the charitable organization approach, we needed to establish independence from pharma, totally an arm's length relationship. We did that by making sure that we had a board, first of all, that was independent, no pharma relationship whatsoever. We did it by establishing disease funds that people could access, obtain grants from, that we defined, that we made sure that we were the ones who were determining where the need was. We did our own assessment of that. We did our own definitions of what ought to be included. And we also included every product that would be used for that particular disease fund, not just a particular product of for example, a donor that was a pharmaceutical manufacturer. So the independence was really kind of core to our being able to maintain this, and the compliance with the regulations that were, as I said, pretty prescriptive, very detailed. So Dave, compliance is so important at HealthWell, as I've mentioned, that we have a board level chief compliance officer, and you held that position at the outset when that was created. So would you talk a little bit about compliance and the importance of compliance to the mission of HealthWell?
There's nothing more important to the HealthWell mission than compliance. Without compliance, we can't do anything. we have a rigorous system in place to ensure that we have complete independence from influence, which is essential to keep our prerogative of providing care to people who need it. We need to track the funds that come from multiple sources, and we need to distribute those funds to hundreds of thousands of people. So it's complicated. HealthWell has never had in its entire history any problem with the federal action or any type of court case surrounding compliance. One of the only foundations in the country that can say that. So I feel that we're in a very good place in compliance, but remains probably our most central theme. Steve, I was especially pleased that you took over as compliance officer when I became board chair, and you left the seat of board chair and became compliance officer, because it gave continuity and also stressed the importance of compliance for the organization.
I appreciate that, and I think that underscores exactly the point about how significant compliance is. It is core to the mission of the organization. Curious, how did you become involved with HealthWell? I was there at the outset, but you came in maybe a couple of years later.
Right.
What was it that attracted you to HealthWell?
Believe it or not, I met a board member, one of your board members, Dr. Carterin, was at a church coffee that I was at. It's unusual because it was in New Jersey and she's from California. But she was there and then she was talking about HealthWell. And I was fascinated and I chatted with her and she said, what do you think about joining the board? And that was 18 years ago. And I joined the board. And then right after I joined the board, we did a session with folks that got our care, got our aid. And there was a gentleman who had macular degeneration. He was going blind. And he couldn't afford the medication that could deal with that. So he set aside his daughter's college education fund to pay for his care, and then he said, I can't do that. So he said he'd go blind rather than take away his college education from his daughter. HealthWell stepped in, gave him the money for his medication co-payments, and his daughter went to college. And I was so impressed because it gave a human face to the aid that we provide.
That's really kind of significant because that story is repeated over and over again. That was the need we were setting out to address.
Right.
Again, people who had insurance but weren't able to afford their out-of-pocket expense. But that was the need when we began. How do you see the need changing or has changed at this point?
If anything, the only thing that's changed is the need has gotten greater. There's more, I love the word you use, financial toxicity, because that's what it is. Cost is shifted to the patients, and the patients are the least capable of bearing that burden. And so the need for HealthWell to step in and help people meet the costs so that they don't go without medication, so that they do get the care that they need, is even more essential than it's ever been. And it's the compliant environment that HealthWell has created that allows it to continue to do that. So, as you can see, the need has only grown. Costs are increasing. Patients are the people in the middle that are stuck with these expenses. There have been some changes federally that you alluded to earlier, with Medicare making some changes, but HealthWell is still needed. It's still there. Also, how do you manage the numbers? I'm going to toss that back to you. How do the operations work that you track all these patients and still stay compliant?
Well, it's an interesting challenge because we want to be sure that it's easy, transparent for people to be able to apply. People who are eligible, obviously, sure. But we don't want to complicate it because their lives are already complicated enough, frankly. We've been really good about the way in which we've been doing our operations. First of all, we have great transparency. We've actually been increasing our efficiency. We keep looking at new ways of making sure we process applications and award the grants. We have a proven track record of using donations effectively and efficiently. We regularly receive a 99 rating from Charity Navigator, for example. We're recognized by Forbes as one of the 9, I think, charities nationwide that achieves 100% fundraising efficiency rating, which is pretty impressive. When you think about the numbers of applications, the numbers of people we're dealing with on a day-to-day basis, we have over 200 people working, most of them are at our call center, where we take the phone calls, process the applications, make sure the grants are going out. And again, as you pointed out earlier, we gave out more than $1 billion in 2023. So you can only imagine the amount of effort necessary to support that. The call center gets maybe 1,000 calls a day. The staff is very focused and very well trained to understand who they're dealing with. I mean, they're dealing with people who are in stress. And so, as I said a minute ago, we want to make sure that we make it easy for people who are applying. Other thing we've been doing, I think very successfully, is outreach, making sure that people know about us. We have obviously our website, which is visited quite frequently. We have made relationships with just a number of other organizations that are engaged with healthcare, particularly patient advocacy organizations, to make sure that people are aware of us. So if if they come across individuals, in the case of providers, if it's their patients, in the case of advocacy groups, it's their constituents whom we can help, they know how to get to us.
I want to go back to something you said just a minute ago. You talked about 100% fundraising efficiency, and some of our viewers may not know what that means. It means that 100% of every dollar that we raise goes to benefit the people that we're benefiting. So every single dollar is used that way. We take our administrative costs on our own hook. Everything comes out of the donated dollars go 100% to the people in need. I think that's amazing.
Yeah, no, it's really important for us. I mean, that statistic is one we take great pride in. The donations we get go to help the beneficiaries, and administrative expenses handled separately from our own funds. And and what's been nice to see has been, frankly, patient or beneficiary responses. We've gotten some beautiful letters of gratitude. And we're very proud of that. We have posted in our own offices, some of those letters, and it really helps the staff to understand in a very direct fashion that we are helping people. We are helping people who are grateful for it. But it's not about the gratitude; it's about the help that we're focused on. The other thing we've been doing in that regard. And again, it's part of the operations, and we do it, I think, thoughtfully, is moving beyond disease-based funds. That's how we began, as we discussed earlier. We're now looking at other ways in which we can support people in need in the healthcare system. So we've started funds now that are focused on behavioral health, particularly associated with people who are dealing with various cancers. We've started a pediatric fund that it's not disease specific. It's based on need and may fall into categories that we don't actually have another fund for. We've started covering, in some cases, travel expense or vitamins and supplements. We've started initiatives around caregivers because caregivers are also critical. They're there as we are to help the beneficiaries, and they need their own support systems and matters of that nature. So we continuously look at how we can apply the systems we've been developing and the donations that we're receiving for broadening out ways in which we can help people.
Well, I can say as a former EMT and a firefighter for 30 years, as volunteer, that the latest action of HealthWell in the EMS and the firefighter and police community with nurses and doctors, especially on the heels of COVID, was a welcome sign in a population that has some dire need.
We've talked a lot about the successes of HealthWell and its what it's done in the past. As the chair now, what do you see as the future of the organization?
Well, I'm going to build on your legacy. We've recently passed our 1 millionth patient, as you know. We awarded over $4 billion in financial support to people in need. Going forward, I'd like the foundation to be able to continue to serve people in different circumstances. We're looking to support patients not only in copayment, but in other different ways that they may need that addresses the financial toxicity they find when healthcare insurance is not enough for them. The board is in the midst of a strategic planning process to try to put that together. So I'm excited about it. The one thing that will not change is the need that has been there for over 20 years. We could go on forever with this, Steve, but for the benefit of people watching us, I want to suggest we've gone over compliance, we've gone over the patients we treat. I hope you'll go to our website, healthwellfoundation.org, and you'll find great detail on all the things that we've talked about. Thank you for being with us, and I thank my colleague Steve for joining me as well.
Thanks, Dave.